report today details the toll lung cancer is taking on public health. The American Lung Association's data breaks down the challenges faced by each state. More than 350 people die from lung cancer nationwide every day. But there's been a 22% increase in survival rates over the past 5 years. Mike Seelbach joins us now to discuss the findings. He's the American Lung Association's National Assistant Vice President for State Public Policy. Good morning, Mike.
Good morning, Mary. Good to see you.
Let's start with New York. Lung cancer is still the leading cause of cancer death. What needs to change to increase survival rates?
So what we need to see more of across the board is that more eligible people are getting screened for lung cancer. We have expanded the universe of people that are eligible for screening. So if you are somebody between the years of 50 and 80 and smoked a pack a day for 20 years, you might be eligible for screening. And we know that when folks are screened early, they have a much better prognosis.
And the study found Black New Yorkers are less likely to be diagnosed early. What needs to be done to close the health disparity gap?
You know, I think it really is about awareness and removing the stigma that comes with lung cancer. And we are starting to see the disparities decrease, which is great, but we have more work to do. And, you know, that's something that we see across many health aspects, that there is a disparity between white New Yorkers and people of color, and we need to keep working to reduce those disparities.
In New Jersey, the study found similar concerns about early diagnosis, but also disparities in treatment, even differences in the patients getting surgery. Can you explain and offer any recommendations here?
Sure. So in New Jersey, we saw that Black individuals are the most likely to receive no treatment when after diagnosis. And so that's something that we really want to make sure that, again, if you're diagnosed with lung cancer, there are treatments that can provide long lives at this point, even after a lung cancer diagnosis. So we want to remove that stigma. We want folks to talk to their healthcare professionals, because if you're diagnosed early, surgery is a great first step, but there are other treatments, including obviously chemotherapy, radiation, and other pharmacologicals that really sustain life for a long time now.
And earlier this month, the American Cancer Society updated lung cancer screening guidelines. What does your organization recommend about who should be screened and when should that testing begin?
So as I mentioned earlier, we agree with those recommendations, and we've been calling on them as well, that if you are somebody between 50 and 80 years old and smoked a pack a day of cigarettes for 20 years, you might be eligible for lung cancer screening. And so you can go to our website at lung.org or talk to your physician about the potential for screening.
Mike Seelbach from the American Lung Association, thanks so much for joining us.
Thanks, Mary.
If you'd like to read the full report, you can go to our website, cbsnewyork.com.